The Affordable Care Act makes special improvements for the health of those in Indian country. The provision of health care services to American Indians and Alaska Natives is a key component of the federal government's trust responsibility. And the updating and permanent authorization of the Indian Health Care Improvement Act helps fulfill this responsibility. The law also offers American Indians and Alaska Natives more options for health insurance, while continuing to permit American Indians and Alaska Natives to get their health care through the Indian Health Service, tribal, and urban Indian health programs. Today, we'll briefly discuss how the Affordable Care Act impacts American Indians and Alaska Natives and what the marketplace means for you. Tribes fought for more than a decade to reauthorize and update the Indian Health Care Improvement Act. Prior reauthorization of the law occurred in 1997. The permanent reauthorization that occurred under the Affordable Care Act provided important updates to the Indian Health Service. Expanded authority for Indian Health Services includes the ability for Indian Health Service to modernize its health care delivery system and permit tribal governments to make technical changes in the future, including authorities for new and expanded programs for mental and behavioral health treatment and prevention, expanded authorities for long-term care services, including home health care, assisted living, and community-based care, new authorities for the development of health professional shortage demonstration programs, expanded authorities for funding of patient travel costs, new authorities for demonstration projects for innovative health care facility construction, new authorities for the provision of dialysis services, improvements in the Contract Health Services Program, which pays for referrals, new authorities for facilitation of care for Indian veterans, and new authorities for urban Indian health programs. The Health Resources and Services Administration designated all Indian Health Service, tribal, and urban Indian health programs as National Health Service Corps sites. The National Health Service Corps and the Indian Health Service offer primary care providers and students financial support in the form of loan repayment and scholarships to cover the cost of their medical, dental, or mental and behavioral health education. For American Indians and Alaska Natives, this means that the financial support offered allows students to come home and help the communities in which they were once patients themselves. So, be sure to encourage young people in your communities to take advantage of the health care pipeline that the Affordable Care Act invests in. To find out more about these programs, visit nhsc.hrsa.gov or loanrepayment.ihs.gov or scholarship.ihs.gov. It allows for expanded third-party funding. Medicare, Medicaid, and the Children's Health Insurance Program and private insurance-covered populations will increase payments to the Indian health system to support both direct care and contract health care services. This will free up Indian Health Service, tribal, and urban Indian funds for expanded services. When private or government insurance money, also known as third-party billing, is added into the Indian health system, it can help improve services for all American Indians and Alaska Natives. The law opens up many avenues for tribal and urban Indian clinics to bill insurance plans. Third-party billing will add new money because tribal facilities will be able to collect reimbursements from private insurance directly. The Affordable Care Act and the Indian Health Care Improvement Act together strengthen the entire Indian health system, from building a pipeline for providers to increasing sources of third-party billing and protecting those precious contract health service dollars. The top things that you need to know about the Affordable Care Act and Medicare for Indian Country. First, your Medicare coverage is protected. Under the new health reform law, your existing Medicare covered benefits can't be reduced or taken away. You will not need to change coverage or enroll in the marketplace, but the law improves Medicare in a few key ways. You may get cheaper prescription drugs. If you're in the donut hole when you buy brand name prescriptions, you will receive a 50% discount automatically when you fill your prescription. You don't have to do anything to get it. And when the Indian Health Service, tribal, or urban Indian health programs provide the prescriptions, the cost incurred by that facility will count toward the donut hole. You get free preventive services. Medicare now covers certain preventive services and annual wellness visits without you having to pay a copay or deductible. Your doctors are supported to better coordinate your care. They are working to get you the care you need at the time you need it and provide you with the highest quality care possible. The law fights fraud and strengthens Medicare. The Affordable Care Act builds on efforts to combat fraud and abuse in Medicare. These efforts are saving billions of dollars in money that was being stolen from the program and returning those dollars to the Medicare trust funds. Individuals with Medicare may qualify to get help paying for their Medicare Part A, the hospital insurance, or Medicare Part B, sometimes called the medical insurance premiums. States have programs that can help Medicare expenses like premiums, deductibles, and co-insurances. Check with your Medicaid or state agency to obtain further information on this program. States have new opportunities to expand Medicaid. Specifically, for American Indians and Alaska Natives, if you are eligible to receive services from an Indian Health Service, tribal, or urban Indian health provider, you will pay no premiums or enrollment fees. Medicaid eligibility determinations will generally consider income and not other conditions. Money from Indian land or resources, individual Indian monies, sometimes referred to as AIAN accounts, money from fishing, farming, hunting, and money from items of cultural or traditional significance are not counted for eligibility for Medicaid or the Children's Health Insurance Program. If you have ever used an Indian Health Service, tribal, or urban Indian health provider, or received a contract health service referral, you won't have to pay copays, co-insurance, or deductibles for Medicaid services. The marketplace is a new way to find quality health coverage that can help you if you don't have coverage now or if you have it but want to look at other options. It will permit individuals and small employers to directly compare private health insurance options based on price, benefits, quality, and other factors. The marketplace will also tell you if you qualify for free or low-cost coverage available through Medicaid or the Children's Health Insurance Program. American Indians and Alaska Natives who enroll in or buy health insurance can continue to receive health care from their Indian Health Service, tribal, or urban provider. Nothing in the Affordable Care Act disrupts that important relationship. Marketplace basics. When you shop at the marketplace, everything you need is laid out for you. All your costs are stated up front, so you'll get a clear picture of what you're paying and what you're getting before you make a choice. About 90% of the people who currently don't have insurance will qualify to get a break on their costs. This includes coverage by Medicaid, the Children's Health Insurance Program, and cost savings in the marketplace. You can find out if you are eligible for advanced payment of the premium tax credits, cost-sharing reductions, or public health coverage programs to make coverage more affordable. Thanks to new rules and expanded programs, even working families will be able to get help through the health insurance marketplace. There will be new expanded programs available, and more people than ever will qualify for free or low-cost health insurance programs. Even if you think your income is too high to get help, you should apply. One application, one time, and you'll see all the programs you qualify for. There are 4 ways to enroll: online at healthcare.gov, by phone, by mail, and in person. Every state will have a health insurance marketplace with open enrollment beginning on October 1st, 2013. There are 3 types of marketplaces. States have the option of running their own marketplace, or they can partner with the U.S. Department of Health and Human Services to partially run the marketplace, called a state partnership marketplace, or they can opt for a marketplace run by the U.S. Department of Health and Human Services called a federally facilitated marketplace. Currently, 18 states and the District of Columbia are operating a state-based marketplace. 7 states are operating a partnership marketplace, and 26 states have a federally facilitated marketplace. The map on the slide shows the type of marketplace for each state. The Affordable Care Act has the potential to benefit all American Indians and Alaska Natives. No one plans to get sick or hurt, but most people need to get treated for an illness or injury at some point, and health insurance helps pay these costs. If more individuals in Indian country have health care coverage, more will have the peace of mind and security knowing that they will have insurance that will protect them and their communities. In addition, with more people getting coverage, services can be expanded at Indian health facilities through increased reimbursements. The Affordable Care Act includes special protections for American Indians and Alaska Natives. American Indians and Alaska Natives enrolled in a qualified health plan can continue to receive services from the Indian health system. For American Indians and Alaska Natives, there is no cost sharing for services provided by the Indian Health Service, including the 638 contract health programs. Indian tribes, tribal organizations, or Indian organizations, or urban Indian organizations, or through referral under contract health services. Lastly, members of federally recognized tribes and other individuals eligible for services from the Indian Health Service are exempt from the shared responsibility payment for maintaining minimum essential coverage. To further expand on zero cost sharing, members of federally recognized tribes enrolled in a qualified health plan offered through the marketplace will not have cost sharing with respect to essential health benefits that are covered through the plan. It should be noted that for covered benefits that are not essential health benefits or benefits that are not covered, a member of a federally recognized tribe will have cost sharing. Additionally, American Indians and Alaska Natives eligible for Indian Health Service, tribal, or urban Indian health care do not have to have health insurance if they do not want it. They are exempt from the requirement to get and maintain minimum essential coverage, and therefore exempt from the individual responsibility payment. Members of federally recognized tribes also have special enrollment periods, so they can change their enrollment status in any plan through the marketplace once a month. If you enroll in a health insurance plan through the marketplace, you can still keep receiving services from the Indian Health Service, tribal health programs, or urban Indian health programs. Why get health insurance if you receive services from an Indian Health Service, tribal, or urban Indian health program? By enrolling in a qualified health plan, Medicaid, or the Children's Health Insurance Program, American Indians and Alaska Natives have greater access to services that may not be available through their Indian health system provider. Also, when services are provided by Indian Health Service hospitals and clinics, these Indian health programs benefit because they can bill the insurance company and bring important resources to their programs. These new resources can help strengthen Indian health programs for the future. A visit to a tribal clinic or hospital can be billed to insurance, and in turn, there will be more resources for your clinic. Insurance will pay for services referred outside of the Indian health system instead of contract health services having to be used for those services. This slide represents the level of coverage. What the plan pays on an average and what enrollees pay on an average in addition to the monthly plan premium. Note that these are an average cost of an individual under the plan and may not be the same for every enrolled person. The bronze plan on average pays 60% of costs and the beneficiary pays 40%. The silver plan on average pays 70% of costs and the beneficiary pays 30%. The gold plan on average pays 80% of costs and the beneficiary pays 20%. And for the platinum plan, on average, pays 90% of costs and the beneficiary pays 10%. You could be responsible for a higher or lower percentage of the total cost of covered services for the year, depending on your actual health care needs and the terms of your insurance policy. Generally, plans with a higher actuarial value and less beneficiary cost sharing, such as the Platinum plan, tend to have higher premiums. Premiums for bronze level plans are going to be cheaper than premiums for a platinum level plan because the beneficiary cost sharing is higher. Those American Indians and Alaska Natives eligible for cost-sharing reductions might want to look at lower premium plans to save additional costs. A model single streamlined application will be utilized by the federally facilitated marketplace. American Indians and Alaska Natives living in states with a federally facilitated marketplace must use the standard form of the streamlined application, which includes Appendix B. Appendix B captures information on tribal status for American Indians and Alaska Natives. States operating their own marketplace have the option of utilizing the model application or developing an alternative application to be approved by the Secretary. The application has been designed for paper and online options. Marketplaces began accepting applications on October 1st, 2013 for coverage beginning as soon as January 1st, 2014. You can apply online, by phone, by mail, or in person. Once you submit a streamlined application to the marketplace, your application is verified. For members of federally recognized tribes who want to take advantage of the special protections for Indians, verification of tribal membership will be required to be submitted within 90 days of application. As of this date, a paper copy of the documentation will need to be mailed to the address on the paper application. You may be determined eligible for the marketplace. And that is to purchase and enroll in a qualified health plan through the marketplace. Or you may be determined to be eligible for Medicaid or the Children's Health Insurance Program. If you are eligible to enroll in a qualified health plan in the marketplace, you will also find out if you're eligible for the premium tax credit and the cost-sharing reduction. You then enroll in the program for which you are eligible. Marketplace initial enrollment period starts October 1st, 2013, and has a monthly enrollment period for American Indians and Alaska Natives. Marketplace eligibility requires consumers to live in its service area and be a U.S. citizen or national, or be a non-citizen who is lawfully present in the U.S. for the entire period for which enrollment is sought. And no one who is incarcerated is eligible for these services. As mentioned earlier, the marketplaces offer comprehensive health coverage through qualified health plans. Qualified health plans must cover the same set of items and services known as essential health benefits. They include doctor's visits, hospitalizations, medications, and mental health and substance use disorder services. The law directs that essential health benefits be equal in scope to the benefits covered by a typical employer plan. The advanced premium tax credit. The new premium discount available through the marketplace lets you reduce your costs right away. People who qualify can take the premium discount in the form of advanced premiums to lower their monthly marketplace health plan premiums starting in 2014, which can help make insurance more affordable. A payment will go directly to the insurance company. When you apply, you will provide your household income and other information. The premium discount is generally available to individuals and families with incomes between 100% and 400% of the federal poverty level. That is equivalent to $23,550 to $94,200 for a family of 4 in 2013. Certain American Indians and Alaska Natives who purchase health insurance through the marketplace do not have to pay co-pays or other cost sharing if their income is under 300% of the federal poverty level, which is roughly $70,650 for a family of 4, or $88,320 if you're living in Alaska. Starting in 2014, most people must have minimum essential health coverage or pay a shared responsibility payment. If you don't have a certain level of health coverage, you must have to pay a fee with your tax return. That health care coverage includes employer coverage, Medicare, Medicaid, the Children's Health Insurance Program, TRICARE, certain Veterans Administration coverage, or individual health care policies, or a plan in the marketplace. Starting when you file your 2014 federal tax return in 2015, the shared responsibility payment starts at $95 per year or up to 1% of your income, whichever is greater. By 2016, the payment will rise to $695 per year per person, or 2.5% of the income, whichever is greater. The shared responsibility payment is capped at $285 in 2014 and rises up to $2,085 in 2016. How do American Indians and Alaska Natives receive a hardship exemption from the shared responsibility payment? Members of federally recognized tribes may apply through the marketplace or handle this through the tax filing process. Individuals who are not members of federally recognized tribes but are eligible to receive services through the Indian health system must apply for an exemption through the marketplace. The application process provides for an American Indian or Alaska Native to attest that he or she is a member of a federally recognized tribe. The attestation is used to determine eligibility for cost-sharing exemptions and monthly special enrollment periods. Marketplaces must verify the attestation of Indian status through documentation provided by the federally recognized tribe. At this time, there are no electronic data sources available to the marketplace which have been approved by the U.S. Department of Health and Human Services to support verification. Therefore, the marketplace will implement a paper documentation process for the verification of Indian status. The marketplace will accept documentation issued by a federally recognized tribe evidencing membership. For Medicaid, you will be asked if you could receive services from an Indian health system provider. Your state may require verification under Medicaid, but does not have to ask for proof. Slide 20. October 1st, 2013 marked the opening of the health insurance marketplace. People can now enroll for coverage that began January 2014. Marketplaces are up and running. Denial of coverage based on pre-existing conditions or gender will be prohibited. Annual limits on insurance coverage will be eliminated. Advanced premium tax credits will be available. Access to Medicaid will expand in certain states. This is a historic time for those Americans who have never had health insurance, who had to go without insurance after losing a job or becoming sick, or who had been turned down because of a pre-existing condition. Because of these new marketplaces established under the Affordable Care Act, millions of Americans will have new access to affordable health insurance coverage. Some key points to remember. American Indians and Alaska Natives can still go to their Indian health system provider. By enrolling in Medicaid, the Children's Health Insurance Program, or a qualified health plan, we are helping the Indian health system by bringing in precious resources that can be used to expand services. Members of federally recognized tribes who are enrolled in a qualified health plan offered through the health insurance marketplace will not have to pay any cost sharing if their household income is at or below 300% of the federal poverty level, and they are eligible for monthly special enrollment periods. American Indians and Alaska Natives who are eligible to receive services from an Indian health system provider will receive an exemption from the shared responsibility payment. If you have questions or need help applying, there are several resources that will be available, including a toll-free call center and website with plan comparison tools. There are also several programs to help you through the process of enrolling and using health insurance, including the Navigator program. Assistance can be provided in 150 different languages, including some native languages such as Yupik and Navajo, and we're looking at providing that assistance in additional native languages. Community-based organizations, agents and brokers, along with other trained enrollment assisters at Indian Health Service, tribal, and urban clinics will also play a large role in helping people apply for health insurance coverage. CMS regulations permit agents and brokers to help consumers and small businesses enroll through the marketplace if the state permits. It is important to note that some of the assistance resources, like the marketplace call centers and websites and navigators, will be unbiased and impartial, while others, like agents and brokers and issuer websites and call centers, will not.